I think what's amazing about what I do is that no day is the same. One day I get to talk to people on NPR. Another day I get to see patients that I've seen since they were babies. Another day I'm writing, a research paper. Every day is a little mini adventure, and I'm so excited that I get to live that. My name is Nia Hurd-Garris. I'm a pediatrician and scientist at Lurie Children's Hospital. I am on a quest to break down barriers for children so that they can thrive no matter what life they're born into. I feel so privileged because I'm a pediatrician. I work in the outpatient setting, but I'm also a researcher, so I get to see both sides. So one-on-one, getting to know my patients and getting to know my families, but then also on the science side, thinking about how do we help populations of people. So beyond the clinical walls, how do we think about equity and how do we think about things that impact children and how to remove those barriers for them. Children that are exposed to adversity are more likely to grow up to have heart attacks, stroke, and cancer. And I want to understand, how do we not only disrupt that, but help children in the midst of that adversity so that they can grow up to thrive, have academic success, social success. That's really important to me. I really believe that we should be partners in the child's health because unfortunately I only see them maybe once a year, maybe a few times a year for 20, 30 minutes. And the parent has to go home and really help that child thrive. So I view our relationship as a partnership. You can bounce questions off of me, I'm gonna ask you questions so that we can ultimately provide the best care for your child, your most precious asset in the whole entire world. I think Lurie, in so many ways, is willing to be bold in not only our care of patients, but also bold in our advocacy and our policy efforts. I think it's pretty unique that we have ethicists, geneticists, qualitative researchers, clinician scientists, and basic scientists that are all working different ways, but all working towards that same mission and that same goal to help all children grow up healthy, despite whatever they're born into. So I think that's amazing.